Okay, so I'm going to ask you just a few questions.
Sure.
Um, what made you go into the field that you're working in right now?
Yeah. Well, I was an actor in college
Oh, interesting. Where'd you go to
and
college?
and a filmmaker. I went to Wichita State.
Okay.
Was a part of the theater program there, and then I went to the New York Film Academy
Okay.
and did their guerrilla filmmaking course, which was a kind of short-term intensive course where you work with people from all around the world and you shoot 16 movies in 8 weeks.
Okay.
And when I got done with that, I really loved it. I realized I didn't want to do it for my living at that point. And I knew that I was going to get married and I needed a real job. And so I went back to school and tried to find something that meant something to me. And I started off in the nonprofit world in child welfare and worked almost 12 years in that world. And through that, I became acquainted with the behavioral health system and the idea of holistic care, mental health, integration with primary health care. And that really was what brought me into the world of health. It just seems like there is so much need and so many opportunities to try something new, to try to figure out new strategies to help people. And that's what I like to do.
Okay. All right. Um, would you go ahead and describe like your typical work day or work week for me? Does it change or is it kind of the same?
Mine or at the office?
Yours.
Mine. So, um, it's pretty variable. I often come to work on Monday morning with kind of a plan for the week, and I'll get to the end of the week and find that I didn't do much that was in my plan. We're a very small office here at Medical Service Bureau. We have 7 staff. So if we have staff out doing community events, if we have staff helping do vision screens in schools, if we have just people sick or people on vacation, people you have to cover. And one of the things I love about working in nonprofits is you get to wear a lot of hats. So there are ample opportunities if you want to try your hand at any number of things. If you go to work for a nonprofit, you will get to try all of those things. And so for me, the vast majority of my job is fundraising, looking for grants, trying to figure out how to sustain us, managing our operation, and then looking to the future. What are ways that we can have a greater community impact? What are ways that we can communicate better the impact that we already have in the community? So I spend a lot of time trying to figure that out, trying to figure out how to make us run more efficiently so that we can be a viable entity for another 81 years, because our organization's been here since 1937.
That's amazing.
Yeah, it's a real testament to the needs and to how long this idea of healthcare access has been an issue.
So clearly you and everyone you work with make an impact on people's lives. Do you have a particular time that you reflect on that you can remember where you know that you made an impact and how it made you feel?
Sure. I think the biggest things for me, I don't get to work directly with clients that much anymore in this role. So the biggest things for me are when somebody comes into my office and has a case that they've been working with that has just hit barrier after barrier after barrier after barrier, and we are able to figure out, either because I make a phone call or because my staff are aware of alternative resources in the community, we're able to find them something they didn't know existed. A good example of that, and of some really neat collaboration that I think about all the time, is last year in the hurricanes, we had a number of people displaced from Florida and Puerto Rico, but primarily from Florida, who came here and came to us because we had medical in our name, hoping that we could help them get health care. They didn't have their prescriptions. They literally walked out of their door to evacuate and then found out that they couldn't go home. So we had people turning up here who needed help figuring out the healthcare system in our community. And the ladies who are our direct care staff are amazing, and we're able to identify, here are health providers in our community who can help you with your specific needs, and beyond that, here's what we can do for you once you see a doctor, and here's how we can take care of all of your needs. And one woman in particular was very, very shaken up when she came in, and it really touched me how we engaged with her and how we were able to find her the appropriate resources so she could get service here.
What personal qualities and abilities do you think are important to helping you be successful in your career?
I think a willingness to do anything, to do whatever you need to do, and passion. You have to have passion for improving health, improving the status of our community. If you have that, everything else kind of falls into place. You figure out how to get things done, you figure out how to make things work, you figure out how to tie people together and how to build relationships, if that is your end goal. If you're ever not focused on that, then I think things start to fall apart. But being willing to take on whatever role people need, and for me, it's really been being willing to go beyond what you thought your day would look like, let go of that structure and say, I'm just here to serve. I'm here to do what is needed, and I'm going to do that every day to the best of my ability.
Kind of surrender to a plan.
Yeah. Well, and interestingly, I don't think I realized how our organization fit into public health until the last couple of months.
So how does it fit into public health in your perspective?
Well, we provide access to medications and to vision care, so to medically supportive services for a population that has no other way to access those services. So you can go to the health department and get access to your immunizations or to other triage sort of health care, or you can go to the emergency room and kind of get the same thing. But if you can't be compliant with your, if it's your diabetes equipment, supplies, if you can't afford test strips, if you can't afford your medication to be compliant, then the next time you're off, you're going to find yourself back in the emergency room. So we contribute to keeping people healthy and to helping them maintain so that they don't have to access the system as often. And we spend a lot of time partnering in the community, figuring out, do people know who we are and what we do, and are there better people we could send other people to? So when somebody comes into our office, we want it to be a situation where if they show up at our office and they have needs that extend beyond us, we can tell them where to go, who to talk to, and how to solve that problem. And that very much is what public health is to me. I mean, it is solving the community health problem.
Absolutely.
As a vital partner in that process. So
it's a team effort.
Yeah.
Sure.
Yeah, and it's amazing to watch the team work. They really can do amazing things.
Yeah. Because everyone wants to help everyone. That's kind of why we're all in public health.
Yeah,
At least
absolutely.
I hope so.
Absolutely.
So it's not like you're on a team and there's one person lacking or slacking behind. It's everybody's trying to find all the puzzle pieces to kind of work together and make it fit.
Yeah, and I think that's one of the things I love about this system is that we're trying to help people with sometimes life or death needs, but we're trying to help them with to live and experience a better life.
Mm-hmm.
And there is such a recognition in this system that you cannot do that on your own.
Yeah.
That whatever you are doing is great, and it is also insufficient to the greater whole that is a person's health. And so having the opportunity to contribute a tiny piece, if that gets you going, if that gets you excited, this is what you should do. Because all those tiny pieces add up, and they make something beautiful.
Yeah. That's very well said.
No, I don't.
I like it.
Thank you.
Just going to ask a few more questions and then we'll be done.
Sure.
How do you see your job field changing in the future for the better or the worse?
So one of the things that is really hitting nonprofits like mine and public health organizations is funding is becoming more and more scarce. It doesn't matter if you're a government entity or a nonprofit trying to solve a community problem. Finding funders who are open to do what many people consider in our community to be charity, true charity. We are a safety net that exists below traditional services to make sure that people don't fall into the cracks. And funding those things is hard for funders, philanthropies, government agencies. It's hard for them to put their money there because there needs to be better tie-in from what is your initial service and how many people do you serve, not just to do they now feel better, are they more compliant, what are the long-term health ramifications for that person? Are we keeping them out of the emergency room? Are we making it so they can work because they're no longer so disabled that they're unable to work? These are the types of things that, especially small organizations, we don't necessarily have the money to go, yeah, let's do a big study and hire a university or hire some data analysts to come look at our stuff. We have to figure out how to connect all those dots and make it make sense to people. And that is one of the things that I think has changed the most during my career and continues to be an issue. The need is only growing, and the resources available to meet that need are shrinking. And the other thing that's facing this system is that we have so many providers who are doing the same thing and lots of holes. So there's a lot of duplication in some general areas, and then there's a lot of specialized work that there aren't enough providers to do. And in the nonprofit world, we're seeing more and more people start their own new nonprofits instead of finding a nonprofit that's aligned with their personal mission, mm-hmm. and then helping that nonprofit be the best it can be. And that change as well is making it a lot harder to accomplish your goals, because then you're splitting funders and donors in a whole bunch of different directions.
And spreading it out more.
Yeah, and it makes it very hard to figure out how to continue to do your piece.
Okay. If you could give one piece of advice to someone going down your career path, what would it be and why?
I think the best advice I could give is say yes more than no. Be willing to say yes to things that maybe you initially want to turn down, because you may find out that there is something out there that you can help with that will touch your soul that you never considered doing. And you can do amazing things. You can do really beautiful things working with this population, working with people who, and I say this population, I mean everyone who has healthcare needs. You can do amazing things for people if you're just willing to open up and listen to them and treat them like human beings. And I think that's what served me the best is trying to not shut myself off automatically and say, well, if I don't understand something, it's not good. If you say yes, you're constantly learning. You're constantly trying new approaches, listening to new voices, and I think those are hallmarks of being successful.
All right. Thank you for your time, Aaron. I appreciate
Absolutely.
it. I'm glad we got to do this. It's nice to learn more about what you guys do here.
Yeah.
And obviously, we think you're doing something right.
I'm honored to be included, and I'm excited to see where it goes. It's been very cool getting to work with Becky and getting to work with these professionals in our community who are really doing amazing things.
Yeah.
Wichita's a pretty cool place for supportive nonprofits, supporting services for folks who are homeless, folks who are impoverished. We really do have a familial community that's trying to take care of each other. We don't always agree on how to do it, but everybody's trying, and that's. I'd much rather exist in a place like this where everybody wants to do something good than to live in a world where there's better collaboration among a much smaller subset of providers, because you just can't do as much.
Yeah, I hear you.
So what do you
Starting-
do? What do you do? I just
I
got.
my this for my capstone class
Mhm.
at WSU, and I'm getting my degree in public health science.
Oh, cool.
Yeah. So
That's very cool.
yeah, I'm pretty excited.
When do you graduate?
In May.
Okay. I'm trying to finish my thesis right now.
Oh. Well, then you know what it's like to be in my shoes right now. So
Yeah. I should be in the last stretch, but I blew up my project, so we'll see where I'm at. I'm kind of starting over, so we'll see where I'm at.
Thank you very much.
Yeah.
Appreciate your time.
Thank you.
And have a
Appreciate
good
it.
afternoon.
You too. Thank you.